You're listening to How I Transform This, presented by Versus 12. Versus 12 is the award-winning Salesforce Gold consulting partner focused on healthcare innovation nationwide. In this episode, Marc shares about the exciting work Kroger is doing through its Food as Medicine initiative, which includes efforts to educate the public while also providing more healthy and affordable options for shoppers. He also explains why engagement and personalization are the keys to better health outcomes.
Because it can be confusing what to eat. Food labels are challenging, and they can be a mystery to folks. And so we want to be able to make it very, very simple for them to choose food that is fun, right? All foods can be fun, but understand what foods are potentially better for me.
I'm your host, Clark Buckner, and along with Versus 12 founder and CEO, Tammy Hawes, each episode, we're seeking out healthcare technology industry leaders, exploring stories of success through the transformation of healthcare. For more stories like this, head on over to versus12.com/podcast. All right, let's jump in.
Good morning. My name is Marc Watkins. I'm the Chief Medical Officer at Kroger. I've been in this role and with Kroger for a little bit more than 5 years now.
Welcome to How I Transform This. We're so excited not only to have you here with us today, but this is our season finale for season 2.
And we're rounding it out with the best. Marc, I'm so excited to have you here. You are one of the most intelligent people that I know and also one of the nicest. So thank you for being here.
Incredibly kind words, Tammy, and it's a pleasure to be here. Thank you.
So my favorite part of this podcast is I get to meet all of Tammy's really cool friends. So I understand you both met through the National Healthcare Council Fellows Program. When was that?
2016?
Yeah, you're right. Wow, how time flies.
And were you at Kroger at that time?
I was in that role, and my role has transformed a bit. I was specifically the Chief Medical Officer and Vice President of our little clinic division at that time. We have about 220 plus retail health clinics in our Kroger stores around the country.
It's interesting because when I think of Kroger, of course, the first thought is groceries, but there's so much more to it than that.
Oh, yeah, absolutely. And, as America's oldest and largest traditional grocer, we've been around for 136 plus years, and really clinics and pharmacies and the things that we do inside our stores are really to continue to provide value and loyalty to our customers. Really, that's what we really want this to be about, and convenience, making it easy for them.
So, Marc, what led you to Kroger's? Tell us about your journey.
Oh, man, that's my wife's an emergency medicine physician, and she often teases me about how I've ended up here. And while we were vetting and coming on to this into this role, we have a little thing at home that we have to be able to explain what we want to do really on the back of a cocktail napkin, and really has to be really succinct. And so she interrupted her favorite TV show, and I think it was Scandal or something at the time, and she said, "Explain to me why a doctor wants to go to Kroger." And I said, well, I got to get ready for this in my head. And so I said, you remember when we were in medical school, how we really wanted to improve the health of the communities that we served? And what better way to do this between the marriage of healthcare provisioning from our clinic side of the business, the pharmacies, but then in the center of this is food. And the things around how can we improve health at a population level. You can do this through the lens of the grocer and being able to position healthy foods, because we know the correlation between unhealthy diets and chronic disease, and what better way to influence that. And that was the reason why I wanted to get involved. And with my background in preventive medicine and public health, it only made sense. And she looked at me and she went, "Oh, okay," and then turned her TV show back on. So it was really quick, and I'm really pleased we made that decision to come on board.
Yeah, I've heard you speak before about food as medicine, and it seems like a novel idea, and it really shouldn't be. I mean, we know this intuitively that we need to eat better and eat healthy. So tell us a little bit more about your vision for that.
Well, it's something that I've been personally involved in transforming myself over the past 3 years of improving my diet and then improving my health. But it's really the vision of our collective team. We Kroger Health is made up of a little bit more than 22,000 associates around the country. But really, our approach is that we believe food as medicine is really a dedicated, educated, and personalized approach to eating and enjoying food so we can live healthier lives and prevent illness before it starts. And that's really important because right now, 7 out of 10 Americans have a chronic disease. We also have a epidemic in this country around things like obesity, and we know that's only getting worse during this pandemic, right? And we are spending an incredible amount of money, and I think you and I from our healthcare fellows class know that healthcare spending probably is going to top $4 trillion in terms of what we're spending, and that's just a huge amount of money if you think about the effect that we're getting. We're not healthier. Usually you think, hey, if I throw more money at something, I should get something better in return. But we're not seeing that with healthcare. We're spending more, but we're sicker, and that's really something that we want to be able to position food as medicine as another complement to things like pharmaceuticals, things like treatment and care, to offer our clinicians a better way, and all clinicians a better way to help their patients. Because you said something very interesting, because it can be confusing what to eat. Food labels are challenging, and they can be a mystery to folks. And so we want to be able to make it very, very simple for them to choose food that is fun, right? All foods can be fun, but understand what foods are potentially better for me. And that leads me to maybe talk just briefly about our Opt Up app. And we're very proud of this. This is a nutrition rating system that really makes it easy for folks to understand the complexities around a food label. So if you think about what makes up food, from your macronutrients to your micronutrients, how much of things like fat should be in food and sodium, and you start thinking about these things, they can be overwhelming. Well, this Opt Up app makes it pretty easy, right? It moves you from things that are in red, which we want that to be less than 10% of your overall diet. And those categories, right, within a red category, we try to opt you up to something that's a bit more healthier, based on the food density and how that food is scored in our system. If we get you in that price point that is your price point, right, we don't want to move you to something that's way above your price point, but keep you in that same category, but move you up to something that's healthier. And that gets you into yellow. Things that are in yellow, we want that to be around 40% of your diet. And then things that they go into green, if you can think about a green leafy vegetable or healthy other items, we want that to make up 50% of your basket. So it's an easy system, and then we can also personalize that for you. And I think that's important, right? Because we have to remember that just like healthcare, food and the food we eat is a very personal thing. And there's a strong emotional connection that we make with food from a cultural perspective, from a familial perspective, that we've always, it becomes nostalgic almost when we talk about your mom's food, right? Going home to family dinners. We laugh with food, we celebrate with food, we mourn with food, and it's part of our life, right? And we need it to continue to live as well. We want to be able to say, hey, if you are interested in a vegan diet, a vegetarian diet, a Mediterranean diet, heart-healthy diet, you're concerned about diabetes, we've embedded these personalized tags that allow you to say, hey, I want to do paleo, or I want to do keto. As you scan these foods, it'll tell you immediately, hey, that falls into your category. Or, oops, no, that's not in your category. And then you can begin to make educated, really, decisions, right? To say, okay, wow, I know I might get these cookies, But I know it's in moderation, right? It's going to be a treat. It's not going to be a staple for my diet. And I think most people would appreciate the simplicity. And because, some of the most simple designs, even though we have a lot of technology running in the background to make it easy, but it has to be easy so folks actually uptake this, right, and they actually use it. So that's what we've been working on, and I get really excited about that piece of what we're doing around our food as medicine approach.
That is so fascinating. So this is a mobile app that you take in the store with you, right?
Correct.
Is it available now?
It's available now, and you can get it from the Apple Store and on the Google Store as well, and any of those Android platforms. And so it lies right into your app today. And then in the future, you'll see it integrated into our Banner app, which is the Kroger family of stores, into our Banner app. So it's even easier to use moving forward.
So it's called Opt Up?
Opt Up, correct.
Okay, that's cool. So I know that's going to give me a lot of red when I go over to the cupcake aisle, which is my favorite aisle in Kroger's.
Well, yeah, thank you. Thank you for shopping at Kroger. We appreciate that.
I've come a long way because when I was at college in Belmont here in Nashville, I remember my now wife, her name's Hope, she gives me a hard time about this story, but basically I went to our Kroger near Belmont, and my groceries was an apple pie and a party pack of Mike's Hard Lemonade. And now when I go to Kroger, I'm much more in the green.
That's right.
I'm staying on the edges of the grocery. I'm getting, all fruits and vegetables, and I'm a long way now. So I could have used this app a long time ago.
Yeah, and as that was then, right? And you're different now, right? And we all continue to evolve and grow and you learn, right? And part of this is that journey of learning and trying to get just a little bit better every day. And that's what we've been on that journey to get better every day.
So Kroger Health and Kroger have put a lot of focus in healthcare technology and innovating with technology to help its consumers be healthier. So I think you spoke about another app you have, SureCare?
Oh, correct. Yeah. So the Assure Care platform is something that, again, the goal here is to simplify our solutions to make it easier for our clinicians. And when I talk about our clinicians, it's both our pharmacists, our dietitians, our nurse practitioners, our technicians around the country. So that as they are on their platforms, right? And this is running on the MedCompass platform, but Assure Care is one of the first platforms that fully will integrate with our pharmacy data solutions, and then be able to then circle and pull in real-time claims data as well. And the idea here is to really provide meaningful real-time information to clinicians to be able to close gaps in care right at the pharmacy counter. And remember, the pharmacists are probably, and they are the most accessible healthcare providers in the country. And so those interactions, as you're picking up your meds, you're getting your flu shot, and hopefully you got your flu shot, Tammy.
I did.
Good. And
Yep.
Yeah, we definitely want our clinicians to have that power to integrate and be able to get information in real time and then make meaningful decisions, right? That they can connect and continue to connect with our patients and customers on that emotional or personal level. And it's really, how do we know actionable information that these clinicians can practice at the top of their license to really affect change and drive down some of this issues that we're having with this overspending in healthcare and just not moving the mark with helping people live healthier lives.
That's very interesting. I have personal experience with my mom. She had a couple of prescriptions at one pharmacy and a couple more at Kroger. Mm-hmm. And I have to kind of get all of that rounded up and all over to Kroger.
Again, thank you.
Yeah. But she was so confused about what to take, when to take it, if there were any drug interactions. And I would think that would be very difficult for a pharmacist to provide complete, care to a patient if they don't really have a total list.
Yeah, it does complicate things, but with our technology, we can see across some of the platforms and get a better understanding. But you're right. When you have things that are disparate, not interconnected, you don't have the ability to have a complete vision and a holistic approach. Our President Colleen Lindholtz of Kroger Health really has led the charge around everyone adopting this holistic approach, right? How do I leverage the things that we're doing in order to deliver better value, not only to our patients, but to our partners? And the story you're telling about your mom is very common. And getting it all under one roof allows our pharmacists to do the things that they're trained to do and really do these comprehensive medication reviews, really to optimize that, really to make sure that there's no interactions. And that really provides a better solution for your mom. It really demystifies this. You understand what to take, how to take it, and the pharmacist can be there for you to answer questions as well.
That's great.
Mm-hmm.
So, Mark, you were just talking about earlier just your background in preventative medicine, community health, and Kroger really as a vehicle to improve health at the population level.
Mm-hmm.
So I've heard you talk about food as medicine strategy. What is that? What does that mean to Kroger, and how has that been evolving, especially this year?
Well, yeah, and I think that this year has really been a challenge for everyone, obviously, with this pandemic and the toll that it's taken on even our emotional health, right? And then you look at our physical health, there's some consideration. And I think we have, with our food as medicine strategy, 5 buckets that we want to address around population health. And this is a really aggressive strategy. So we call it 20 by 5 by 2025. We want a 20% improvement in these areas of population health. So one is obesity. Second is diabetes. Food insecurity we want to address. We want to address cost of healthier foods. And then we want to improve the assortment of foods on our shelves. And so let me just begin to unpackage that just a little bit. So yeah. I'll start at assortments. And we're speaking with our consumer product good companies, so like the General Mills, the Kellogg's of the world, the ConAgras, to say, hey, how can you help us? If you continue to want shelf space at Kroger, how do you help us develop 15,000 healthier SKUs? So we want 15,000 healthier SKUs. But at the same time, I just mentioned cost. We want to extract $58 billion in savings for these healthier assortments, right? So that we pass that on to the consumer to, again, debunk the myth that you have to be like a LeBron James or Kim Kardashian or Tom Brady to eat healthy. Yeah, you don't need to be a famous football player to be able to eat healthy. So we're going to make that for the common man approach, that anyone could eat healthy if they want to and choose to. And we're going to ask our food partners to drive that cost down. We also recognize that this pandemic has created and has exposed food insecurity around the country. And so we want to have 8 million less people food insecure. Our CEO, Rodney McMullen, has said that no child should be going hungry at night. And we want to do our part to continue around that effort. So we've established a $10 million innovation fund that continues to support local food pantries around the country and continue to encourage our management at stores to adopt ways to not waste food. And that goes really nicely with our Zero Hunger, Zero Waste initiative that we have at Kroger. So we're really trying to decrease our waste, right? Do our part, and especially with food that may just go to landfills, right? Just how can we repurpose that with our partners around the country to improve that? And then last two, and I think this really gets me excited as a physician and as CMO, talking about really tangible 2 areas of disease that we want to tackle. And it's obesity is one, as I mentioned, and diabetes. The interplay between type 2 diabetes and folks that are over their ideal body weight, I think we all know that there's a correlation there. But we want to have 18 million less people obese in this country by 2025. And that can be done by understanding how food impacts your body. And then finally, with diabetes, and right now, We know how much diabetes is costing us. It's a number that is astronomical per year. And I'll share with you, we have about 114 million people in this country that are either pre-diabetic or diabetic at a cost of about $245 billion a year.
Wow.
Yeah, so we want to have 20 million less people to be not diabetic, right? So how do we prevent this before it happens, right? How do we keep the horse in the barn, right? It's hard to run down that horse when it's out of the barn, Tammy. It's too hard, and we're just throwing, medicines at it. And how do we get how do we contain this a little bit better? And we believe with 20 million less people, that equates to about $44 billion in healthcare savings. And these are huge numbers, and we can have 18 million less obese people by the same time. That's another $29 billion in savings to the healthcare system. And that's just with this program and making people more aware of how food impacts your body.
So you mentioned earlier there's such an emotional connection to food. And with this technology that you are implementing, plus different initiatives within Kroger Health, you're really making it interesting and fun for people to dig into their own health and take control. And so I think that is just fascinating because there is such a big emotional component to people taking care of themselves.
I'm glad you mentioned that. Even I'm lucky enough to be around residents and be around other healthcare professionals. And we know that our patients know their bodies the best. They've been in their bodies. And so for me, I've been in my body for 51 years now and have a good understanding of what makes me tick. If we can move to the point where folks are engaged, right, that they are engaged with their own health, that's a win for the healthcare system. That's a win for health in general when you improve not only your engagement, but then you improve things like your health behavior. You improve your health IQ, right? You understand more, so your ability to digest, and no pun intended there, digest information or healthcare information only serves to help with things like adherence and compliance to medications, adherence and compliance to regimens and recipes that really help folks live healthier lives.
So I'd personally like to have a shout out to all the associates at Kroger's that have kind of guided us through this pandemic. I mean, there was some crazy times there early, as far as things going off the shelf. And I can't even imagine the amount of burden that was put on grocery stores to keep everything sanitized and clean and stocked and all that kind of thing. And then also to the pharmacists at Kroger, because I know my mom personally probably goes in every week and spends at least 15 minutes with the pharmacist asking very simple things, but for her, they're very important questions. And so right. I know they spend a lot of time with the customers.
Absolutely. And I cannot be more proud to be fortunate, lucky, and blessed to be at such a wonderful organization. And let me just share with you, since this pandemic started and since early March, Kroger has invested a little more than $1 billion in terms of providing access to things like PPE, putting up partitions, making sure that our stores and manufacturing and distribution centers are safe, and then also instituting things like hero pay, really to make sure that we thank our associates that are on the front lines, really as critical infrastructure workers, making sure that food is still on the shelves for Americans to purchase. And so that's been really rewarding to see the company really step up and say that how important our associates are. And we know that without their tireless and sometimes selfless help, that we couldn't have been here during this pandemic. And you're right. My wife said, man, you imagine if Kroger wasn't around, what would folks do? I go, well, I couldn't imagine it not being around, Deanne. But we definitely want to thank our associates and Tammy. So thank you for the kind words. That goes a long way.
That's good. And thank you for your work that you've been doing for Kroger. I can't imagine what they would do without you, especially in these times. So we are definitely thankful for everything that all of Kroger, you and the team. And I had one final question as we have some time. I'm curious, earlier you were mentioning how you were riding on the back of a cocktail napkin of like, what's your vision? How can you simplify things? So I'm just curious, if you were to write on the back of a napkin, what is health or what is wellness? What would you kind of summarize that to be?
Yeah, I think it's, when you think about health and wellness, it's a combination of things, right? It is about your physical well-being, but also about your mental well-being. And it's that intersection, right? It's a combination of that. And you can't have one without the other, in my opinion. And understanding that you are going on this journey through life and you are trying to get better every day. You're trying to learn a bit more every day. And that journey is really to find balance, right? To find balance between your emotional well-being, which is incredibly important, especially at this time with COVID and the things that we're doing in adjusting to a new normal, right? That adjustment to a new normal can take a toll on us emotionally. And so how do we strike balance? And I think when I think about it, it's how do you just get the right things together, really, from your social structure, your family, things that your hobbies, things that you're engaged in, and how does that come together to help improve your overall well-being? Because it's just not about the physical well-being. It needs to be balanced. And when I think about that, that's what I think about it. So it's not a hard and fast definition. You're not going to find my definition in probably the medical textbooks, but it's really about a balance between enjoying life, right, being present, and being mindful of the things that are going on. And with all of the things that we see on the news, right, we have a 24-hour news cycle, and we see all these things. How do we just be mindful about the things that are going on, but at the same time, taking time to take care of ourselves?
So, Mark, thank you so much for being a person who's very passionate about what you do, and the perfect combination of a clinical expert that's using technology to really transform how we live our lives on a massive scale. And I think it can't go unsaid that one person can actually, with the team, I know you've got a great team, really make some great things happen in this country.
Well, thank you, Tammy. Those are very, very kind words.
Thanks for listening to How I Transform This, Success Stories of Transformation in Healthcare, presented by Versus 12. To learn more about how Versus 12 is best situated to transform the healthcare industry and to follow along with this show, be sure to visit versus12.com/podcast. We'll see you next time.